What you're about to hear will leave you speechless. Sometimes the system fails so catastrophically that innocent lives are destroyed in ways nobody could have predicted. This is one of those stories that makes you question everything about justice, mental health, and how quickly a life can spiral out of control. I first saw him that morning, and something was terribly wrong. Jamal had always been quiet, but that Tuesday morning in March was different. As he descended the subway stairs at 125th Street Station, his hands were trembling uncontrollably. In his pocket, he clutched an empty prescription bottle so tightly his knuckles had turned white. 3 days. 3 days without his medication. The state hospital had given him a number, told him to wait, said there were no doctors available. The private hospital wanted $400 just for the consultation. Money he didn't have. Money his mother didn't have. It was 7:42 a.m. The New York subway was packed as always, the morning rush in full swing. Jamal made his way to the last car. He found a corner and pressed himself against it, trying to become invisible, trying not to make eye contact with anyone. Sweat was already beading on his forehead despite the cool morning air. His breathing had quickened. He could feel it starting, that familiar tightening in his chest, the edges of his vision beginning to blur. The panic attack was coming, and there was nothing he could do to stop it. Across from him stood a man who couldn't have been more different. Richard Morrison, in his $2,000 suit, was everything Jamal wasn't. Successful Wall Street broker, 43 years old, talking loudly on his phone about million-dollar deals and quarterly projections. He hadn't even noticed Jamal. Nobody had noticed Jamal. That's how it always was. Before we continue with this incredible story, hit that subscribe button for more unbelievable true stories that will challenge everything you thought you knew about our justice system. The train lurched suddenly as it pulled away from the station. Jamal lost his balance, his hands frantically searching for something to hold on to. Nothing. His vision was darkening at the edges now. His ears were ringing, that terrible sensation of drowning while surrounded by air. In that moment of pure panic, he stumbled toward Richard. Richard pulled the phone from his ear and looked at Jamal with undisguised disgust. "Watch it," he barked, as if Jamal was some kind of pest that had invaded his personal space. Jamal tried to speak, tried to explain, but the words got tangled in his throat. His mouth opened and closed like a fish out of water. No sound came out. At the next stop, more people pushed into the car. The space got tighter, more suffocating. Jamal's breathing became shallow and rapid. It felt like his lungs had shrunk to the size of walnuts. His hands began to shake more violently. Richard had already turned back to his phone call, completely dismissing Jamal's existence, his obvious distress meaning nothing to him. That's when the train made an emergency stop. Everyone lurched forward. Jamal crashed into Richard, and Richard's phone went flying from his hand, clattering across the dirty subway floor. "What the hell is wrong with you?" Richard shouted, his face red with rage. He shoved Jamal hard. Jamal stumbled backward, bumping into other passengers who looked at him with annoyance and disgust. Nobody helped. Nobody asked if he was okay. They just stared at him like he was the problem. But the real shocking part hadn't even started yet. Jamal's mind was fragmenting. Everything was becoming blurry. Sounds were muffled and distorted. He could hear his mother's voice echoing in his head. "Take your medicine, Jamal. Please, baby. Take your medicine." But there was no medicine. The hospital had failed him. The system had failed him. 3 days of calling, waiting, being told to come back tomorrow. His mother had spent her last $20 on bus fare to get him to the hospital, only to be turned away. The train was approaching 14th Street Station. Jamal could barely stand. His legs felt like they were made of water. Richard had retrieved his phone from the floor. The screen was cracked. His rage intensified. He grabbed Jamal's arm, his fingers digging in like claws. "You're going to pay for this," he snarled. "This phone cost more than you probably make in a month." Jamal's brain was screaming danger signals. Every instinct told him to run, to escape. But Richard's grip was iron. "I'm calling the cops," Richard announced loudly, making sure everyone heard. "This guy's probably on drugs or something. Look at him." The other passengers watched, but nobody intervened. Some pulled out their phones to record. Others just moved away. not wanting to get involved. Jamal was alone in a sea of people. His chest felt like it was being crushed by an invisible weight. He couldn't breathe. The fluorescent lights above seemed to pulse and flicker. Everything was spinning. The doors opened at 14th Street. People began pushing to get out, and others pushed to get in. Richard still had Jamal's arm, trying to drag him toward the door. "You're getting off here with me. We're going to sort this out with the transit police." Jamal planted his feet, every muscle in his body, resisting. "Please," he managed to whisper, his voice barely audible over the noise of the station. "I'm sick. I need—" Richard either didn't hear or didn't care. "Stop resisting. You're making this worse for yourself." He yanked harder on Jamal's arm. That's when something inside Jamal's mind snapped completely. It wasn't him anymore. It was pure panic, pure survival instinct. His body moved without his conscious control. He jerked his arm back with a strength he didn't know he possessed and pushed Richard away. It wasn't meant to be violent. In any other circumstance, Richard would have just stumbled back a step or two. But right at this moment, everything changed forever. The platform was crowded. Richard stumbled backward, his expensive leather shoes slipping on something wet on the platform floor. His arms windmilled as he tried to regain his balance. His eyes went wide with surprise, then fear. He was falling backward toward the platform edge, where it dropped off to the tracks below. Time seemed to slow down. Richard's hands grasped at air, searching for something, anything to hold on to. There was nothing. He fell backward, and the back of his head struck the edge of the platform with a sickening crack that echoed through the station despite all the noise. The sound was so distinct, so final, that everyone stopped what they were doing. Richard's body went limp, instantly. He rolled sideways and fell onto the tracks below. The entire platform erupted in screams. People rushed to the edge. Someone pulled the emergency alarm. The harsh buzzing filled the air. Jamal stood frozen, his mind unable to process what had just happened. The panic attack was gone, replaced by a different kind of terror. He looked at his hands as if they belonged to someone else. Around him, people were shouting, pointing at him, backing away like he was dangerous. "He pushed him," someone yelled. "I saw it. He pushed that man. Call 911. Don't let him leave." "Is there a train coming?" But you haven't seen the biggest surprise yet. 2 transit officers appeared within minutes. They saw Jamal standing there, saw the crowd pointing at him, saw Richard's body on the tracks. They didn't ask questions. They threw Jamal against the wall, cuffed him, searched him. They found the empty prescription bottle. One officer held it up. "Looks like our guy here forgot to take his crazy pills," he said to his partner. Jamal tried to explain. The words came out jumbled, confused. "He grabbed me. I couldn't breathe. I just wanted him to let go. I didn't mean." "Save it for the judge," the officer said. The surveillance footage would become the key piece of evidence. But here's what it didn't show. It didn't show the 3 days Jamal had spent trying to get his medication. It didn't show his mother crying as she counted out their last dollars. It didn't show the dismissive hospital staff who told them to come back next week. It didn't show Richard grabbing Jamal first. Didn't capture the fear in Jamal's eyes. Didn't record his pleas for help. All the footage showed was a black man pushing a white man to his death. The media coverage was immediate and brutal. Subway killer strikes in broad daylight. Wall Street executive murdered by homeless man. They got almost every detail wrong. Jamal wasn't homeless. He lived with his mother in a small apartment in the Bronx. He wasn't a killer. He was a 22-year-old with schizophrenia who had been failed by every system meant to protect him. Richard Morrison became a martyr overnight. His photo, professional, smiling, successful, was everywhere. The news talked about his charitable donations, his 2 children, his wife's grief. They interviewed his colleagues who called him a pillar of the community and taken too soon by senseless violence. Jamal's photo was different. They used his booking photo, where his eyes were wide with fear and confusion. He looked exactly how they wanted him to look. Dangerous, unstable, guilty. Wait a minute. Don't miss this detail. His mother, Patricia, tried to tell anyone who would listen about her son's condition. about how he'd been doing so well on his medication, about how the system had failed them. She brought his medical records, showing 2 years of successful treatment, perfect compliance with his medication when it was available. She explained how he'd never been violent, never hurt anyone, how he was gentle and kind and just needed help. Nobody wanted to hear it. The narrative was already set. The public defender assigned to Jamal's case was overwhelmed, handling 40 other cases simultaneously. He suggested Jamal plead guilty to manslaughter. "It's the best deal you're going to get," he said during their 5-minute meeting at Rikers Island. "You're looking at 25 to life if this goes to trial. Take the deal. 15 years. You'll be out in 10 with good behavior." Jamal was deteriorating rapidly in Rikers. They gave him medication, but it wasn't the right kind or the right dose. He spent 23 hours a day in solitary confinement for his own protection. The other inmates had heard about him. Cop killer, child killer, subway killer. The stories grew with each telling. His mother visited every week, spending money she didn't have on bus fare and commissary. She aged years in months. Her diabetes got worse. She stopped taking her own medication to save money for Jamal's legal defense. She found a lawyer who would take the case for $50,000. She had $500 in savings. You won't believe it, but the real truth is coming out now. 3 months after the incident, a woman came forward. Sarah Chen, a nurse who had been in the subway car that morning. She had recorded everything on her phone, starting from when Richard first grabbed Jamal. Her footage showed what the transit cameras missed. Richard's aggression, Jamal's obvious medical distress, his attempts to communicate that he was sick. "I was scared to come forward at first," she told reporters. "But I couldn't sleep knowing that young man was being painted as a monster when he was clearly having a medical emergency." Her video changed everything and nothing. The prosecutors argued it didn't matter. Jamal had still pushed Richard, and Richard had still died. The media barely covered this new evidence. The narrative had been established. Changing it now would mean admitting they'd been wrong. The trial was a foregone conclusion. The jury, 8 white, 3 Hispanic, 1 Asian, deliberated for 6 hours, guilty of involuntary manslaughter. The judge, citing Jamal's mental illness as an aggravating factor rather than a mitigating one, sentenced him to 12 years. "Mr. Washington," the judge said, looking down from his bench, "your failure to properly manage your mental health condition resulted in the death of an innocent man. While the court acknowledges your diagnosis, it cannot excuse your actions. Mr. Morrison's children will grow up without a father because of your choices." Your choices. As if Jamal had chosen to be sick. As if he had chosen to be denied medication. As if he had chosen any of this. Patricia collapsed when the verdict was read. She had to be taken to the hospital. The stress had triggered a heart attack. She survived. But barely. The medical bills destroyed what little financial stability she had left. She lost the apartment, moved in with her sister, visited Jamal when she could, which wasn't often. What you're seeing now is nothing, because the real tragedy is just beginning. In prison, Jamal was stabilized on medication. The irony wasn't lost on anyone. He could get proper psychiatric care in prison, but not in the free world. He became a model inmate. Quiet, compliant, helpful. He worked in the library, teaching other inmates to read. He wrote letters to his mother every week, telling her not to blame herself, telling her he was okay even when he wasn't. Richard Morrison's widow, Rebecca, did something unexpected in year 3. She started researching Jamal's case. She read his medical history, his mother's testimonies, the nurse's video statement. She visited the hospital where Jamal had been turned away. She learned about the systematic defunding of mental health services, about how people like Jamal fell through cracks that were more like canyons. She wrote a letter to the parole board, supporting Jamal's early release. The media went crazy. Widow forgives husband's killer. Stockholm Syndrome or genuine forgiveness. Richard's family disowned her. His brother called her a traitor on national television. But Rebecca Morrison had done her homework. She'd learned that in the 3 days before the incident, 12 other people with mental health conditions had been turned away from that same hospital. 2 had committed suicide. 1 had been shot by police. Jamal's case wasn't unique. It was inevitable. She started a foundation in her husband's name, but not the kind anyone expected. The Morrison Foundation for Mental Health Access. She used Richard's life insurance money to fund it. She hired Patricia Washington as a community outreach coordinator. The irony was sharp enough to cut. Richard Morrison, who in life had never noticed people like Jamal, whose death had been caused by a broken system he'd never thought about, was now the name on a foundation trying to fix that very system. But there was something she didn't know yet. During the investigation for the foundation, Rebecca discovered something that changed everything. Richard had been on the board of directors for the company that managed the state hospital that had denied Jamal treatment. He had personally voted to cut mental health services to increase profits. He had, in a very real way, contributed to the circumstances that led to his own death. Rebecca never made this public. What would be the point? Richard was dead. Jamal was in prison. Patricia was broken. The system churned on, unchanged. Jamal was released after 7 years. Good behavior, overcrowding, and Rebecca Morrison's continued advocacy had made the difference. He walked out of Sing Sing Correctional Facility on a cold Tuesday morning, exactly 7 years after that morning in the subway. His mother was there, older, grayer, moving slowly with a walker now. They didn't speak. They just held each other and cried. The world had changed. While Jamal was inside, the subway now had barriers on the platforms in many stations. A direct result of his case, and several others, mental health services had been slightly expanded, though nowhere near enough. Richard Morrison's death had become a talking point for both sides, those who wanted better mental health services, and those who wanted harsher sentences for the mentally ill. Jamal found work at the Morrison Foundation. It was Rebecca's idea. "You understand the system's failures better than anyone," she told him. "Help us make sure this doesn't happen to anyone else." Some days, Jamal could almost believe that was possible. Other days, he'd pass by 14th Street Station and have to stop, overwhelmed by memories and guilt. He'd see Richard's face in his dreams, not angry anymore, just surprised, always surprised. Patricia passed away 2 years after Jamal's release. The years of stress, diabetes, and poverty had taken their toll. At her funeral, Rebecca Morrison sat in the back row. When people asked why she was there, she said simply, "She was my colleague and my friend." The last time anyone saw Jamal, he was speaking at a conference about mental health and criminal justice. He told his story without emotion, just facts. When someone asked him if he forgave the system that had failed him, he was quiet for a long moment. "Forgiveness implies that someone was asking for it," he finally said. "Nobody's asking. The system isn't sorry. It's not capable of being sorry. It just is what it is. All we can do is try to make it better. One case at a time, one person at a time." He never mentioned that he still carried that empty prescription bottle in his pocket. A reminder, a warning, a promise to himself that he'd never go 3 days without medication again, no matter what it cost. The Morrison Foundation has helped over 3,000 people access mental health services since its founding. Each success story is a small victory against a massive system. It's not enough. It will never be enough. But it's something. Jamal Washington still rides the subway to work every day. He always sits in the middle car now, never the last one. He keeps his medication in 3 different places: his apartment, his office, his mother's grave where he visits every Sunday. He's never missed a dose since that Tuesday morning that changed everything. Some stories don't have clean endings. Some tragedies don't lead to triumph. Sometimes, survival is the only victory you get. Jamal survived. The system survived too, largely unchanged despite all the promises and protests. Richard Morrison's children grew up without a father. They were told he was killed by a dangerous man on the subway. Only when they were older did they learn the full truth from their mother. One became a doctor, specifically a psychiatrist. The other became a civil rights lawyer. Their mother never remarried. The 14th Street Station still has a small plaque that most people never notice. It doesn't mention Richard Morrison or Jamal Washington by name. It simply says, In memory of those lost to preventable tragedies, may we do better. We haven't done better. Not yet, not enough. But tomorrow, someone with schizophrenia will walk into the Morrison Foundation clinic and get the medication they need. Tomorrow, someone's son won't become another Jamal. Someone's husband won't become another Richard. Tomorrow, one tragedy might be prevented. It's not justice. It's not redemption. It's just what Patricia Washington used to say when she visited Jamal in prison. We do what we can with what we have, baby. That's all anyone can do. The last car of the subway still runs every morning at 7:42. Most people don't know its history. Most people don't need to. But sometimes, in the early morning light, when the car is almost empty, you might see someone clutching an orange prescription bottle like a lifeline, and you'll understand that for some people, those pills aren't just medication. They're the thin line between being a patient and becoming a headline.